like to introduce my special guest, Dr. Joel Kahn. He is the Director of Preventive Cardiology and Rehabilitation at Detroit Medical Center. And I'd like to start with talking to you a little bit about your nutritional philosophy when it comes to heart patients.
Sure. Well, most important is to prevent, because it's actually a much harder disease to try and remove once it's already built up in the arteries. And what we're talking about is plaque, hardening of the arteries. We've got 3 really nice pipes to our heart, and they're similar to the pipes to our brain and other parts of the body. And they should be soft, flexible, and without blockage. But unfortunately, there's a lot of factors, and there's more than there's ever been. Nutrition is probably 3/4 of the battle. No, you don't want to smoke. You do want to get fitness. You want to get a night's sleep. You want to learn about some of the poisons in the environment. But if you're eating wrong, which the majority of Americans unfortunately are, you're much more prone. So my philosophy is to educate people about what to put in, what to take out, some baby steps. But it's a mean world out there, and it's hard to do it right. And it takes really self-education. You got to read some books on your own heart health.
Awesome. So I'm vegetarian, and part of the reason why we picked Save Oz, I know that you're also vegan, and that's a great philosophy when it comes to heart health. Can you talk a little bit about plant-based diet versus maybe a paleo diet or some other diet that has been popular in the media, but how it affects heart health?
Sure. A very popular way to eat is what's called the Mediterranean type diet. And we're excited about it because almost 20 years ago now, it's amazing that still it's not as popular as it should be because the research came out. A large study with hundreds of people who survived a heart attack in France, in Lyon, France, were put on the Mediterranean diet, rich in greens, rich in fruits, rich in nuts, seeds, olive oil, wine, very light on red meat, very light on red meat, a little bit of other meats, but still light. Cut the second heart attack rate, the chance of dying after a heart attack, by more than 50%. I mean, more powerful than any drug we have was changing your diet. So there are some wonderful books, one called Eat, Drink, and Be Healthy by Dr. Willett at Harvard, that describes the results of the Mediterranean diet. Some people vary it and make it an Indo-Mediterranean diet, throw a little tofu in, a little Asian-type food. You can do a Middle Eastern variant of Mediterranean diet with some lentils and tabbouleh. But the core is a very low in processed food, very low in sugar, very high in fresh, real food. If I had to give kind of 2 things to add and 2 things to take out, I clearly tell people if you're going to add, and you may be surprised by this, the first one would be add spices. Simplest thing you could do today is pick up, strangely, I would suggest you pick up a bottle of curry powder. Curry powder, I've studied this, has 7 or 8 different spices. Each individual spice has heart-healthy benefits, like turmeric, like cumin, like rosemary, sage, cayenne pepper. What's the big deal? Whether it's a salad, whether it's your dinner meal, add some curry powder into your life. You add it into a soup. And the other one is, strangely, I actually carry apple pie spice in my car. It's got nutmeg, cinnamon, clove, allspice. Those are the 4 most powerful antioxidant spices in the world. You're looking at a bowl of oatmeal and you dump some apple pie spice. There's no sugar in it. You can get pumpkin pie spice. It'll have ginger in it, which is also good. You just dump some on your oatmeal. You have changed your oatmeal from a good meal to an unbelievably good meal due to antioxidant power. Start that today, no big deal. But all the spice, rosemary, sage, thyme, a lemon balm, oregano, go on and on. They can really boost the power. The second thing to add is vegetables. And steamed, raw, organic if you can afford it. Eat vegetables 2-3 times a day. You should be getting 5, 6, 7 servings a day. You can sneak in some extras with something like low salt V8 juice. I don't like regular V8 juice, but low salt. It's got a lot of something called lycopene, which is the great nutrient in tomato. Really can make a big difference in your arteries, 1, 2, 3. There's no excuse not to get vegetables in your life. Excuse me. Fruit's a little less important, but vegetables are just powerhouses. What should you take away? You should start cutting out sugar. I mean, we are a sugar-toxic world, and that's cookies, cakes, and drinks in the coffee shop that are loaded with whipped cream. We're learning for sure that sugar's inflammatory. If you saw my Facebook today, we've learned in fruit flies this week. You give a fruit fly sugar, they get heart disease. We thought there was a connection. We've shown it in fruit flies, and it'll be shown in humans scientifically for sure. And the other would be probably takeaway. Be very careful about fried foods. It's just a way to take maybe a medium healthy item and completely destroy it, both by adding fat content to it, very often trans fats, which are the most dangerous fats in terms of your cholesterol, diabetes, artery damage.
It was so great to have Dr. Kahn with us, giving us a world of information. Great things to remember is making sure you get that exercise in 150 minutes every week, making sure you're eating a more plant-based diet, so making sure you're getting lots of servings of vegetable, at least 2 or 3 times a day, and making sure you're not smoking. If you need help, there's great places to go. A great resource is the American Heart Association online. Don't forget to visit my blog at Kapnick.com. We'll see you next month. Bye.